Welcome to this educational program. This module discusses the treatment of bladder infections in women. It is hoped that you will have already viewed the presentation entitled Understanding Bladder Infections in Women prior to this one. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Bladder infections are very common. Approximately 5% of all women per year experience one, and by age 24, at least 1 in 3 women have had at least one infection. Overall, for any woman in her lifetime, there is a 50% chance of experiencing at least one bladder infection. Bladder infections have a bad habit of occurring more than once. Without treatment, most bladder infections will clear themselves. However, 50% of such infections will occur again later. Even when treated, 20% of infections will recur. The reason that women are so much more prone to bladder infections than men can be explained mostly by differences in anatomy. The female urethra, or urine channel, is short and straight, allowing easy travel for bacteria or germs into the bladder. The opening to the female urethra is also close to the vagina and anus, where many bacteria normally live. We have many natural defenses against bladder infections, including normal bladder emptying, which must be complete and regular. Also, women have a normal collection or flora of organisms in the vagina, which do not cause bladder infections because they cannot cling onto the lining of the urinary tract. These bacteria act to suppress the growth of the bacteria which can cause bladder infections, so their presence is very helpful. The growth of these organisms depends on the tissues in the vagina being healthy, and this at least partly depends on the presence of the female hormone estrogen. Proper basic hygiene and cleanliness, of course, also helps to prevent bladder infections. Most bladder infections are easy to recognize. Women experience the sudden onset of frequent, painful urination and have strong urges to urinate. The urine may be foul-smelling, cloudy, or even bloody. The presence of fever, back pain, and vomiting may suggest that the infection has spread to the kidney. In these cases, you should seek medical help right away. So how do we treat a bladder infection? There are 3 important factors: clearance of the organisms, or germs, control of the symptoms, and prevention of recurrence. Antibiotics, which are medications that kill bacteria, are of course the most powerful way to clear these germs from the urinary tract. These drugs will speed the clearance of bacteria from the urine, and they will lessen the chance of having another or recurrent infection. Beyond just taking antibiotics, however, other efforts must be made to help clear the infection out of the urine, by drinking plenty of water and taking care to empty the bladder as best as possible. Some women, in fact, are able to clear infections quickly this way if they recognize the onset of symptoms. At the same time that the infection is being cleared with antibiotics, and for some time afterwards as the inflammatory reaction settles down, women should try to drink plenty of water to keep the urine dilute, and some women may need to take medication to further help control the symptoms caused by the infection. Anti-inflammatory medications, such as acetaminophen, commonly known as Tylenol, or ibuprofen, known by brand names such as Motrin or Advil, can help with the pain caused by the inflammation associated with the infection. Phenazopyridine, also called pyridium or Fenazo, acts to soothe the bladder and urethra and limit the burning or irritating sensation caused by the infection. If you take this medication, be aware that it will turn the urine orange, which can cause some staining of clothing. Finally, a number of bladder-relaxing medications, or antispasmodics, can be prescribed, such as oxybutynin, known as Ditropan, Ditropan XL, or Oxytrol, tolterodine, known as Detrol or Detrusitol, trospium chloride, also called Sanctura or Trosec, solifenacin, known as the brand name Vesicare, and darafenacin, also called Enablex. These drugs relax the bladder muscle and can give relief from the frequent urination and urgency associated with bladder infections. These are not commonly used in this setting because they can have side effects and because the symptoms usually do not last long enough to warrant it. Having said this, some women may require them. Finally, measures to help prevent a recurrence of the infection should be undertaken. The use of appropriate antibiotic therapy will help this to a degree, but other simple measures which we have previously discussed in the introductory module on this topic should be employed as well. To summarize, this includes regular and complete emptying of the bladder, topical estrogen in postmenopausal women when necessary, and modification of sexual practices as outlined. Cranberries, vitamin C, probiotics, and vaccines are as yet unproven, but are widely used and are being studied intensely. Recommendations for antibiotic therapy vary widely, depending on the region you live in and the health authority you ask. We will not attempt to make any firm recommendations here, but simply to give some generalized information about some of the common antibiotics used to treat bladder infections. Please note that the specific situation for any individual patient is taken into consideration when choosing antibiotic therapy as well. Factors such as urine culture results, patient age, allergies, and the likelihood of pregnancy, for example, are all important. Keeping all of this in mind, your doctor will individualize your treatment to achieve the best chance of success. The first class of antibiotic drugs we will discuss is called the quinolones. Due to high resistance rates to other antibiotics, these have now become the recommended first-line treatment in many parts of the world. These include, in no particular order, ciprofloxacin, also called Cipro or Cipro XL, levofloxacin or Levaquin, gadafloxacin, Tequin, norfloxacin or Neuroxin, and ofloxacin or Floxin. In many areas, resistance rates to these medications are low. Resistance is when an organism finds ways to resist or become insensitive to the effect of the antibiotic. Usually, these drugs are effective in just a few days, and some can be taken just once a day, making them convenient. A disadvantage of this class of antibiotic is its expense. Also, some patients should not take certain of these medications, including pregnant women, growing children, and patients taking certain blood thinners and some other medications. Talk to your doctor or pharmacist or consult with the product monograph if you have any specific concerns about any medication. Another common antibiotic used to treat bladder infections is Nitrofurantoin, also known among other things as macrodantin or macrobid. This drug has the advantage of low resistance levels and high levels of the drug get into the urine. Because the drug mostly accumulates in the urine, it does not kill the so-called good bacteria in the vagina or the bowels, and it is less likely to lead to yeast infections after treatment. A disadvantage of nitrofurantoin is that it does not get into the bladder wall, so it is not good for more complicated infections. Similarly, it does not penetrate into other body tissues, such as the kidney, so it is not effective against kidney infections. For bladder infections, it sometimes also requires longer treatment time, for example 7 days instead of 3. Finally, long-term use of this medication may lead to side effects on the lungs and nerves. The so-called sulfa drugs are actually a combination of two medications, trimethoprim and sulfamethoxazole. It is the sulfamethoxazole that is the sulfa-containing component. Examples of these sulfa drugs include Septra and Bactrim. Sulfa drugs have the advantage of being very potent drugs for killing bacteria. These agents are able to penetrate or get into the bladder wall. Therefore, they are better for more complicated cases. The main disadvantage of this medication is that many bacteria have developed ways to become resistant to its effects. In North America, depending on where you live, up to 18 to 25% of the organisms causing bladder infection may be resistant to these drugs. Side effects, such as stomach upset, are unfortunately common with these medications, and allergies to the sulfa part of the drug are also relatively common. Finally, some serious side effects can be associated with these medications. It should be pointed out that the trimethoprim component of these drugs, with the trade name Prolaprim, can be used effectively on its own in certain situations when allergies are a concern. The final class of antibiotics we will discuss here are the penicillin-type drugs. For bladder infections, we usually refer to either amoxicillin or amoxil, or drugs called cephalosporins, which includes the commonly prescribed drug Keflex. These drugs are generally safe and inexpensive, and are able to penetrate the wall of the bladder to fight deeper infection. The problem again with these antibiotics is that germs have found ways to resist their effects. Generally, a longer treatment time is necessary compared to other agents, and again, allergies are not uncommon. Finally, the dosing of these drugs can be a bit inconvenient, as most people need to take them 3 or 4 times a day. Many women who experience a bladder infection are on the pill for birth control. It should be pointed out that some antibiotics can lessen the effectiveness of these oral contraceptives. These can include amoxicillin, ampicillin, and sulfa drugs such as Bactrim and Septra. These interactions should be discussed with your doctor if you are prescribed an antibiotic. It is recommended to use backup contraception throughout antibiotic therapy and up to 1 week after completion. It should also be pointed out that some antibiotics should be avoided in pregnancy. It is best to avoid getting pregnant if you are on antibiotics. If you are pregnant or think you might be, then your antibiotic treatment should be adjusted accordingly by your doctor. Some women unfortunately suffer another bladder infection not long after a previous one. These are called recurrent infections. When infections occur less than 4 times per year, it is best to simply deal with them promptly and appropriately as we have previously described. At some point, urine cultures should be performed to get an exact idea of the organism involved to be sure that antibiotic therapy is appropriate, and antibiotics may need to be adjusted accordingly. If you experience more than 4 infections per year, it is recommended that you see your doctor, as you may need further tests done or a specialist referral to be sure that there is no underlying problem to explain the infections. In most cases, there is no underlying problem, and the focus remains on preventative measures and prompt treatment of each infection. Some management options in these situations include self-start antibiotic therapy, pre- or post-coital antibiotics, or antibiotics prior to or after sex, and suppressive antibiotic therapy. Self-start therapy involves keeping a supply of antibiotics at home and taking a short course of them at the onset of symptoms. Pre- or post-coital therapy involves taking a single dose of an antibiotic just before or after sexual intercourse and is only for women who experience bladder infections that are always related to sexual activity. Suppressive antibiotic therapy is a last resort treatment option. This involves taking a very small dose of an antibiotic on a regular basis, in other words, daily or every other day, for an extended period, such as 2 or 3 months. When done carefully, this can allow the so-called good germs in the body to regrow and suppress the bad germs that cause infection. Potential problems with this approach include bowel side effects, yeast infections, and allowing organisms to develop resistance to the antibiotic. All of these treatment options should be discussed with your doctor as necessary and should only be undertaken carefully. Due to the urgent nature of these problems, many women end up being treated for bladder infections through an emergency room or after-hours clinic. It is recommended that you see your regular doctor if you experience any of the following: more than 3 infections per year, symptoms that persist after treatment is completed, visible blood in the urine, high fever, vomiting, chills and shakes, or pain in the flank. In summary, the treatment of bladder infection involves clearance of the infecting organisms from the urine, measures to relieve symptoms, and the prevention of further infections. Prompt and appropriate antibiotic treatment is the key to successful early treatment and can lessen the likelihood of a recurrence. This treatment must be tailored to the individual patient. Keeping well hydrated and emptying the bladder regularly and completely are helpful measures. When needed, some medications do exist that can help lessen the symptoms of a bladder infection. Please consult a doctor for additional help. These resources may help you find further information or support about bladder infections. These current references were used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of the treatment of bladder infections in women. We wish you the best for the future, and thank you once again for viewing this educational program.